Hi, I am Susan, your health counselor from dxsaver.com. Today I am going to explain some interesting facts about chlamydia in this short video. According to the Centers for Disease Control and Prevention, nearly 3 million people are diagnosed with chlamydia in the United States every year. And, nearly half of the people diagnosed with chlamydia are women, who fall under the age group of 15 and 24. Chlamydia is one of the sexually transmitted disease, transmitted from one person to another through sexual contact. The infection is caused by a bacterium called Chlamydia trachomatis. It is transmitted through vaginal, anal or oral sex. Sexually active young people get infected by chlamydia easily, when having unprotected sex or having sex with multiple partners. A woman having chlamydia can pass it to her child at birth. Chlamydia cannot be transmitted through casual contact like sharing food or drinks, kissing, hugging, holding hands or sneezing. Chlamydia can be differentiated into two types, based on the place in which the infection occurs. One is oral chlamydia. It is transmitted through oral sex, and is very common in the United States. The other type is eye chlamydia. It is transmitted through the hand to the eye, from the spread of infection in the genital secretions. The main cause of eye chlamydia is touching your eyes without washing your hands, after having vaginal sex, or oral sex with the infected person. The infected person does not show any symptoms for several weeks until it spreads to other body parts. Some of the symptoms in women are abnormal vaginal discharge, swelling in the vagina, painful sex, vaginal bleeding during sex, and abdominal or back pain. The symptoms in men are pain in the urethra, milky discharge from the penis, and pain or swelling in the testicles. Other than these, both men and women may have common symptoms like bleeding while urinating, mucus discharge in the rectum, redness, or itching in the eye, sore throat and fever. The most effective way to diagnose chlamydia is to use a cotton swab to take the sample from the infected areas like cervix, urethra, and eye. Generally, chlamydia infection occurs in the cervix, throat or rectum areas in women, and, in men, the infection occurs in their urethra, throat, or rectum. If you suspect the possibility of chlamydia infection, then the right time to take the chlamydia test is at least within 1 to 5 days of exposure. Chlamydia can be cured with antibiotic therapy. It is advised not to have sex for a minimum period of 7 days after the treatment. If chlamydia is left untreated, it may lead to severe complications in both men and women. Some of the complications in men are infection in the urethra and inflammation in the rectum. In women, the complications are pelvic inflammatory disease, infertility, and inflammation of the fallopian tubes. So it is better to prevent chlamydia infection by using condoms and limiting the number of sex partners. If you had unprotected sex recently, or having multiple sex partners, then click on the link in the description to get tested for chlamydia, which I would highly recommend. If you have learned something new about chlamydia, like and share this video. And don't forget to subscribe to our channel to learn more interesting facts about different diseases and medical conditions.